Yes, we are. From the appropriation from last year, we are $35.6 million short. Last year, we received a much higher appropriation than we received this time.
Are you going to be able to find that money anywhere else?
Well, number one, they might be able to earn that money.
Pardon me, sir. Pardon me. What does that mean? Earn that money? Explain that to me.
Well, other contractual services with other hospitals in the city of Shreveport, for example, like the VA, like Shumpert, like Willis Knighton, like neighborhood clinics, maybe like the Dave Range Clinic and other clinics in Shreveport, because we have interns that will more than likely go to these places and earn the money for LSU Med School.
Pardon me. Historically, what is that annual give back to LSU? Do you know?
I don't understand what you mean, give back.
In other words, what do these other hospitals, clinics, et cetera, what is their annual payback to LSU?
Well, now they could make up to $40 or $50 million with contractual services to other clinics and other hospitals in the Shreveport area and the surrounding area.
Is that the only option, Senator?
Well, let me be very honest with you. Louisiana do not have the money to support medical education direct with state funding today. Medical education, just like at LSU in New Orleans, they go out and earn approximately $150, $175 million a year by contractual services. We need to do that also, because once we separated LSU and the hospital, we separate them. Instead of one, we made them two. They do not earn the money because of the patient load is not there for them to earn the money.
Mr. Gregg, when you say that there's not the money to operate the medical school here, you know what you're saying, right?
Now, let me clarify that. We give a base pay, okay? And a lot of people may not understand the interns at LSU have to pay. We pay them for being interns. Say they're doctors and they're out there practicing and training, okay? And we have to pay the supervisor doctors that oversee their training. And under medical education in Louisiana, we get a base pay, okay, about maybe $60, $70 million base pay. But we have to earn the other. And when LSU and the hospital was together, they were very easy because they commingled the money and they had enough money to provide the services at LSU. I hated to see us separated, but it was the thing of the day. We had to separate.
Could this also be handled through cuts, which would mean ending some programs, losing some jobs? Is that an option?
That's not an option. We cannot cut services. When you cut services, you deny people good medical care at LSU. So we can't cut the type of service. What service are we going to cut?
Now, there are some...
OBGYN? We can't afford to cut OBGYN.
Right.
We just cannot afford that. That's a no-no.
Mr. Gregg, I'm looking at the article here from the weekend, and it says, here's the quote, one consultant for University Health in Shreveport says Department of Health and Human Services projections are mathematically impossible. Break that down for us. What are they talking about? What do they mean?
Well, what is happening, because they do not have contractual services, like in New Orleans, like the Med School in New Orleans. You have about 25 or 30 contractual services. In Shreveport, the Med School have about 3 or 4 contractual services. They need to enlarge the scope of their contractual services, and they can earn $60 and $70 million a year.
So
very easy.
Are you laying it in their lap? I mean, why haven't they done this previous, and what can they do?
Well, the one reason they have not done it previously, because if you remember, we just divided not long ago.
Right.
LSU, Med School, and the hospital. We made them separate. They didn't have to do that at that time. Now they have to do that. They have to go out and earn money, just like a wife and a husband have to go earn money for the family. They have to go earn money to stay in business.
Oh, were they okay with that?
Yes, they are okay with it. They have no problem, and they have a facility to do it, and they have the expertise. LSU is the number one hospital in the area. To me, it's number one in the state.
So if we're looking,
I attend LSU myself. I go to the hospital.
If we're looking at 35 point something $million shortfall for LSU here in town, and they need to
it might not be a shortfall.
Well, how much money?
Chicken before the hat. Don't count your chickens before the hat.
How much of that do you think can be made up in these contractual services? Say, if it's not something they're doing now or they're doing minimally, how long is it going to take to build that business? Not long at all. And let me tell you, they can earn not only $35 million, they can earn $50 and $60 million. It's not hard. If you look at the clinics and the interns that is needed in the clinics in Shreveport area, it's very easy, and within the surrounding area, it's very easy for them to earn that money. But they must get out, because University Hospital cannot support the med school because they don't have the volume.
Senator Tarver, the Senate Finance Committee had a long meeting. You're essentially our only representative on that committee. Did you leave that meeting optimistic, or are you still nervous for our local medical community?
I'm not nervous at all about the local medical community. Not at all.
You feel confident?
LSU will be there.